Good morning, good afternoon, everyone who is just joining us on this panel that we have here. We're going to talk about Kenya. These are some of the folks we have in Kenya, very great people, great panelists. And I'm just going to go ahead and have them introduce themselves. I'll start with Trixie.
Hi, everyone. Nice to be here today. Welcome. My name is Trixie Pujol. I'm a clinical counselor. I'm the executive director of Kipapeo Therapies, and I specialize in autism and working with young children with developmental delays.
Thank you, Trixie. Alice Mondia.
My name is Alice Mundia. I am the chairperson of Differently Talented Society of Kenya and also a parent, and I'm glad to be in this forum today. Thank you.
Thank you, Alice, for coming. Pooja.
Hi, everyone. My name is Pooja Panessa. I'm director for Kaizora. There are 3 Kaizoras. There's Kaizora in Kenya, in Tanzania, and the foundation. So I'm director at all 3. I'm also a board certified behavior analyst, and I'm very happy to be here. Thank you for having us, Ruth.
Thank you so much, Pooja. So we're going to go ahead and I'm going to ask all of you, you can jump in, but we'll start with Pooja. How does culture affect autism in Kenya?
So every region has a rich culture, just as Kenya. Kenya is also very much is very religious as well. So all these factors do affect how autism is viewed. I've recently just done a study on stigma, and we're able to see that there's a lot of stigma around autism. There's a lot of different perceptions because of the culture as well. So when we're looking at autism per se, you'll also find a difference in the urban areas and in the rural areas. So in the urban areas where there's a lot more exposure, Nairobi is very cosmopolitan, you see more of the culture moving into trying to educate themselves and find out when you hear something new, what is it? Whereas in the rural areas, you'll still see a lot of belief in witchcraft, in curses, and black magic, and so on. So culture does play a big part, and Kenya's culture is very rich, but it's also very diverse. So depending on where you are, you'll see the different aspects of what autism is viewed as. But I'd love to hear from Alice and Trixie as well.
Yeah, Alice.
Thank you so much, Pooja. I would say yes, it's exactly what you've said. The African continent, I think, is very rich in terms of culture, and even our Kenyan society is extremely rich also in culture and very diverse, depending on various communities. But what cuts across is the fact that the beliefs, the norms are geared towards persons who are more able-bodied and not persons with disability. And so we find that acceptance within the society is very rigid when it comes to persons with disability, and especially with autism, because autism now is a condition that basically you cannot be able to actually see that a person has a disability. So we find that when it comes also to the parents, the things that they hear from others, the things within their own community that probably you did not pay your dowry on time, there are cultural aspects that you have not fulfilled, there are things that you have not done that you need to do. You know, there's so much that happens around the cultural aspect, and the belief that I think probably it dates back to many years. They believe that persons needed to be able-bodied rather than have some certain deficits. Yes.
All right. Thank you, Alice. Trixie, you want to add to that?
Yeah, I think Pooja and Alice have summed that up pretty well, and I'm newer to Kenya, but having worked in the rural communities in my early days here, I definitely saw everything they were talking about and the cultural and stigma. But I also want to say that I think that's universal. I think in any country in the world, you would find similar cultural views, similar stigma, similar, in anywhere in the United States, in Europe and South America, anywhere pretty much. They might be a little different depending on the culture or the community, But I think you're going to come up against that. There is, I mean, people are afraid of things that are different and they don't understand. And I think one of the things with autism that we all know is there are no visual signs. If you're blind, or if you're have a physical disability, it's very apparent. Or if you have something like cerebral palsy or Down syndrome, it's much more apparent. And so I think when it's a disability that isn't, there are no outward signs that are very clear, I think it makes it a lot harder. And a lot of the awareness and the acceptance in Kenya has been around physical disabilities, the vision impaired, the hearing impaired, the physically disabled, and now it's slowly moving to more developmental disabilities. But again, the ones that have more outward signs, and so autism and other things like that, you know, are a little bit harder. But I would say that as Alice was saying, you know, that there's still a lot of work around awareness. We all met through Autism Awareness Kenya, and that was the main goal, was to build awareness. And I know in many other countries, there's a lot more awareness. The campaign is further along. It's still young in Kenya, although amazing things have happened in recent years. So I think as we develop more awareness, the acceptance grows, and as the acceptance grows, you know, it just changes the whole mindset generation. You know, it'll come slowly. And it's come a long, long way in Kenya as well in the time I've been here.
Thank you, Trixie. Okay, this one I'll ask Pooja. What are the patterns that are associated with autism or behavioral with kids with ASD?
Okay, so behavioral patterns associated with autism. So there's definitely three areas that we look at, which is known as the Triad of Impairment in the previous DSM, which has now changed, but I'll still go through them in that way. So one is communication. We know that children with autism spectrum disorder, I like to emphasize on the spectrum part of it, they do have communication and social communication issues. So you might find a child, you have the whole range from those who might not be able to speak to those who are speaking about the same topic, or they're having difficulty with the social communication aspect of it. For example, initiating conversations, making friends, sustaining a conversation. So you can find difficulties in that within the whole spectrum of it. The other one is social skills. So within social skills, you find that children do find it difficult to make friends. It's not that they don't want to. That's something that is, I think, a misconception. They do want to make friends. Everybody does. But most of the time, they don't know how to go about it. So as they're young, you might find that their social skills in terms of developmental milestones are delayed. They might not be playing alongside other children or with other children. If there is games with the rules going on, they might not understand the rules in the games and participate as they're meant to. In initiating interactions as well, there might be inappropriate initiations. So you might find a child who wants to play with someone who's on the swing, but they go and knock them instead, or push a child that they want to try and play with. So there are difficulties in social interactions. And we also see unusual and restricted interest in behaviors and in different items. So there are what we call stimming behaviors or self-stimulation. Some children look for stimulation in terms of their different senses. So you might see visual, you might see auditory, you might find a child who's very sensitive to some taste. And when we look at the sensitivity, it could be hyper, it could be hypo, so they could be over sensitive or less sensitive. So even there's some children I know I've worked with who have a very high tolerance to pain, or those are some of the issues. There's the different five senses that we know of, but then there's also the vestibular and the interoception. So that's where the pain comes in, and the need to bounce around or jump around a lot for those who are rocking and jumping around on trampolines a lot more. We also know that in terms of the restrictive behavior, transition can be a very difficult aspect. So moving from one activity to another, especially from a more preferable activity to a less preferable activity, can be quite difficult. Changes in routine, changes in any patterns of any behaviors that they have, and you interrupt those, that can be an issue. So, I mean, that's some comorbidity with OCD, I would say, but it varies according to each child. So there are different comorbidities that we might see when we are looking at autism. The other thing that I have come across, which I know is not necessarily one of the diagnostic criteria, but I've seen with most of the children that I've worked with, is a lot of fine motor difficulties as well. Not all of them have this, but many do, with writing and some fine motor difficulties around that. So those are the main aspects that we do see when we're looking at behaviors around autism. Um, I again emphasize autism is a spectrum, and more than that, each individual is an individual. More than the label, you and I are different. Two people who don't have autism are different. So two people with autism are also just as different. And it's something that's very important to keep in mind when we're looking at the different behaviors associated. So speaking with parents, with caregivers, with friends, with the nanny is important to be able to understand each individual and what their difficulties and strengths are.
Thank you, Pooja. I'll talk to Alice. Related to your son, what Pooja has said, can you tell us about, I know you can relate it with what Pooja said with your child. Can you unmute? Thank you, Alice.
Thank you so much, Ruth. When it comes to Pooja really brought it out very well on matters on the behavioral part of it, on social interaction and on communication. And I would say I have had a lot of challenges with my son when it comes to issues of communication. In the early years, he was nonverbal, though over time he's been able to gain in terms of speech. When it comes to behavior, I know Pooja has really emphasized it a lot. And one of the key challenges I've had with my son is the self-stimulatory behavior, the hand flapping. And a lot of times he will jump up and down, and he will clap his hands. And basically, this will happen in intervals. Once in a while, and then other challenges that we'll have probably is attention deficit oriented, where he doesn't want to stay in one place long enough. So a lot of times, other behaviors that that I've also witnessed are things to do with sensory. There's kind of like sensory oriented or attention seeking oriented, where probably sometimes he will develop meltdowns, or sometimes he will throw tantrums on various aspects. And in the early years, I would say behavior, the specific behavior is kind of like it's age specific, because I would say the behavior he had in his early years is very, very different also from the behavior that he has also developed at teenage. At teenage, it's more of meltdowns and a lot of I would say the repetitive self-stimulatory behavior. Thank you.
Ruth, you're on mute.
Alice, I know you mentioned about meltdowns and tantrums. Can you
Yes.
try and explain it to some viewers who might want to understand what it means?
So a lot of times, and Pooja is a behavioral interventionist. A lot of times, she's a BCBA. A lot of times, behavior is like a form of communication. So sometimes it will begin very small. Probably it's something my son wants to do. It's an activity he wants to undertake. We are in the kitchen, and I'm kind of like trying to give him some certain instructions. And then it begins like a tantrum. He just begins slow, and then he builds on it. And within a very short while, if you are not watching him, probably you interrupted him, or there's something he wanted and you did not provide, or probably you are in an environment where he's also not comfortable, in a supermarket or in any other environment. So this is the way he responds to a certain environment or a certain stimuli. This is the way sometimes you will miss it, and what begins as a tantrum progresses, and within a very short time I can see that my son displays a meltdown and is all over. Sometimes it's very spontaneous, like it would happen early in the morning. He just wakes up and probably he's not comfortable with the environment, or there's something he wants, or sometimes you cannot sometimes even be able to understand why some meltdowns are happening. So sometimes he would wake up and he just wakes up and he's banging doors, and he wants everyone to wake up very early in the morning. So there's some certain behaviors that I see at teenage that probably were not there when he was younger. I would say, especially during this COVID time, and I've had a lot of parents talking about it, the meltdown-oriented kind of behavior, the sensory-oriented behavior and meltdowns, I would say behavior and problematic behavior has increased during this period of time where children are in seclusion or are just indoors most of the time, and there's not much activity happening within probably the home setup. They are not very engaged, or probably sometimes because their structure has been changed. So there's a lot of problematic behavior happening within this period of time. And those are things I've experienced. The younger ones, what I've had most parents talk about is their children crying over and over, probably at night. Others, you can't put them to bed, they don't want to sleep, and they basically will want to move, just jump up and down, and it's in the middle of the night. They don't want to sleep, or their sleep pattern is interrupted for one reason or another. So there's a lot of behavior, and sometimes it's repetitive, sometimes just behavior happening that is very unique to specific children, but it's also very unique to persons on the spectrum. Thank you.
Thank you, Alice. You want to add something, Trixie?
I think Alice and Pooja covered it really well. I would just add I just want to grow on what Alice was saying on two areas, on COVID and teenagers. I mean, COVID has definitely brought problems, and issues for so many children globally and across the neurodiverse spectrum. But I think like Alice was saying, kids not getting enough structure and routine, parents are completely overwhelmed. Many parents are still trying to work, have several kids at home. Families might be in small spaces that are cramped. And kids not having their routine, their structure, their what they expect, their physical movement, a lot of our kids have sensory needs, and all kids need movement, and regardless, and exert a lot of energy. So I think that's been a real problem. And I think, not sleeping at night might be just not having gotten enough energy out. So I think that's been a real issue, and having to get really, really creative at home, but at the same time, understanding that families are really overwhelmed. So I think that's been a balance. And just touching on what Alice was saying about communication, I mean, I do think that one of the biggest things for kids on the spectrum is often inability to communicate. And that's why it's so important to make sure kids have some sort of communication system in place. But as they get into teenage years, their emotions, their feelings, they change, and they have a lot of hormones going on and things they can't understand. We know, all teenagers can be really difficult and don't have the words to always express themselves, even neurotypical children. And so when, a child maybe doesn't have enough communication, doesn't have a lot of vocabulary, and then they have all these intense emotions, big feelings, hormones going on, it's a really hard time, because on top of maybe not having enough communication in place even prior to that, a functional communication system, now we also have these huge emotions and feelings and hormones and things that, he can't understand, he can't express, and that can be really difficult. So I definitely feel for you, Alice, and I think you're not alone in that. Particularly when kids, even if we've sort of gotten into some routines and we sort of, you might know how to handle behaviors until they get it to be a teenager. And now he's a really big guy, and he's not a little person that you can just pick up and remove and put them in the car. Or, it's quite a scene, and it can be really difficult for families as well. And I think that's an area that just, I think globally needs more attention, and in Kenya as well, the sort of dealing with teenage children on the spectrum, and adults, and the hormonal changes, and sort of going into all of that puberty time.
Thank you so much, Trixie. I'll go ahead with Pooja. You can tell us about your organization's name and what programs you have put forth for families and their children.
Okay. So my organization in Kenya, we have, I'm partnered with a speech therapist called Brooke, and it's called Kaizora Center for Neurodevelopmental Therapies. So we have various therapies working under the same roof. One of the challenges we came into when I was running Kaizora before, Kaizora Institute, and Brooke was running heart counseling, is that we were working alongside, but we found that parents are bringing their child for ABA to me. I've managed organizing a speech therapist to come in house so that they can get speech therapy, but some of them are still taking their child for occupational therapy somewhere else. And you find that the child is losing time. I think more important than hours, these children, especially when they're young, time is very important, it's of essence, and we want to maximize everything we can do. The whole reason we went into the merger actually was to bring everything under one roof. So currently we're offering ABA, which is of course supervised by me. We have speech and language therapy, we have occupational therapy, special education is happening, physiotherapy for those who require vocational training for our older kids, social skills for all levels, and counseling as well, because we have some higher level, higher functioning kids who also need counseling. So we do everything under one roof, and we have interdisciplinary teams working together. So basically what happens is for a child who enrolls, we have, first of all, there's different packages. If somebody just needs speech therapy, one session a week, they can come for that. But if they want all the sessions daily, we have packages that can actually replace schools, so that the child can come and receive intensive intervention on a daily basis. So ABA every day, speech every day, OT every day. And for the child, in each department that they're receiving services, there is a clinician who is assigned to them and a clinical manager who is in charge of bringing all the programs together. So we do a lot of internationally recognized assessments, intensive reports, and those along with the consultations and parents' input is how we create their programs, collect data on all their programs. All the decisions are data-driven. Everything we follow is evidence-based, because we basically, we don't want to waste their time in any way. We want to make sure everything we're doing is effective. So that's the organization in Kenya, and also the same in Tanzania, in Dar es Salaam. And then we also started Kaizora Foundation. Kaizora Foundation is geared basically, I've always had this private organization. I've always been concerned about, okay, what about those who cannot afford it? And that is actually how Autism Awareness Kenya, the interest from there came about when Trixie and I went into that. And now Kaizora Foundation has started, whereby we are trying to raise funds to support children who need services, ABA, speech, physiotherapy, or assistive devices, or the family needs training and support, so that we can fund those things and help families who are unable to afford. So we've been able to help a few children, which we're very happy about, but we do wish for this to get bigger. I mean, it's still a baby organization, and then COVID hit, so it was very unfortunate timing, but it's something that we do hope to keep building upon and reach out to as many as we can. So yeah, those are the three organizations.
Well, that's really good about you guys trying to help the people who can't afford by training and everything. It's really important because, you know, we are all, everybody is struggling, and we'll have those parents who really can't afford the high expenses. Alice, can you chip in on that, please? About your organization, activities, what things you do, and how you can bring parents together.
Thank you so much, Ruth. And I'm glad to hear Pooja has formed the Kaizora Foundation. We look forward to working with you on that one also, to be for parents to get the necessary assistance that they require. Our organization is basically not really professional based, because we are a psychosocial support group of parents with children on the autism spectrum. So when we came together as parents and a few professionals, and came up with the organization that is now Different Talented Society of Kenya, we began like a WhatsApp group. So meaning that we began as a sharing platform. This is a member-based, all caregiver and parents-oriented organization. And why it came about is because of the key challenges parents were experiencing with their children. So when we talk about the various interventions of programs that we have, a lot of times we link up with other organizations to be able to benefit from the programs that they have. And one of the key things and areas of emphasis for us is ensuring that parents are trained to take care of their children at home. And so we link up with various stakeholders, various organizations, and the professionals to ensure that parents are trained on the various issues that are coming up. Like now, during COVID, what we are talking about, the behavioral issues being experienced by parents within the home setup. Other parents will talk about probably self-injurious behavior happening within the home setup. So we link up with professionals in that area, whether they are BCBAs, whether they are educational professionals, special education professionals, whether it's counselors or something like that. So we link up with them to be able to give parents take homes or interventions that they can undertake within the home setup. At the same time, we also organize programs that bring us together. We recognize that the wellness of the parent or the caregiver is very key. So basically, among ourselves, we also kind of like offer each other psychosocial support or a shoulder to lean on. And once you have an issue, you recognize that the age sets, that parents also have children within various age sets, and given that also their children are also at different they are also at different stages or at a different point in the spectrum. So you're able to kind of like match. You're able to match a parent with another. You're able to recognize that probably a certain group of parents all have 15 or 16-year-olds. They have children at teenage. So these parents would link to each other more, would be able to consult each other more on the issues that are happening within the home setup, what professionals have said, what can I do, what are the interventions that can be undertaken. We are able also to link up with the professionals, talk to them, discuss with them, and at the same time, we share the same information within our WhatsApp group on the interventions that are happening in other areas, what other parents have been able to do. So basically, ours as an organization is to kind of like reach out to others, advocate, create an awareness at the same time, and also link up also with government. Like now we have some certain meetings going on with National Council of Persons with Disability to see on to discuss on issues of provision of therapy. We ensure that we are represented when it comes to caucus on disability rights and on matters of policy within the country. So basically, we come together and engage others, engage partners, engage stakeholders, engage government, advocate for the rights of our children, and also ensure that we are able also to take care of our children within the home setup. Thank you.
Thank you, Alice. Trixie, would you add to that?
Sure. Thank you very much. Yeah, Keep It Peo has been around for about 10 years and gone through different phases. The last 2 years, I've been working more directly with the school and a little less doing private practice. But I have I'm building that back up and rebuilding Keep It Peo now. So my background is behavior therapy, early ABA with, and then more recently with trauma-informed practice, attachment, and theraplay. So I bridge the two and sort of bring different philosophies together. And I am offering a variety of services. I believe very much in working with the parent and the family, and a lot of my background is early intervention, very family-based. So I'm providing some of that. Through COVID, I was doing a lot of that online, so providing virtual support to families, helping to put a treatment plan together for them to work with their child. So I'm continuing with that. We're seeing some kids at home and seeing some kids in my new office in Parklands. So I'm continuing doing early intervention, assessing and diagnosing and treating young children with their families. with autism, I do diagnosis. I usually work with a doctor and team of professionals. I'm trained in the ADOS-2, which is an assessment tool, and I use other tools along with that, and then collaborate with doctors and other professionals. I am a clinical counselor, so I'm doing child and parent counseling. It could be counseling around their child with autism. It could be a child without autism, with anxiety, ADHD, but usually working together with the family and helping from the parenting side, as well as what the child's needs might be, putting in tools in place and helping the child work through their issues. I've been doing social skills for many, many years for children with social deficits, and it can be autism or not, and play therapy groups. So I continue to do that. Occasionally, I do social skills one-on-one with a child. Ideally, it's much better to do it with peers in a group. So I've done it with ages from very young to adults. And I continue to have a passion for that. I would love to continue to build groups back up as we come back together. I do some educational support around families who maybe have gotten an educational consultation and then need help deciphering what that means and how to implement and put the strategies in place. And sometimes a lot of that technical stuff can be really hard to break down. So helping families work through that and finding the supports in the community that might help them support that. That's a big part of what I do. I do a lot of workshops and trainings. Since COVID, I've done some COVID trainings online, helping organizations and families support their children through COVID and parenting. And then I've also doing inclusive education. I was working for a few years with a school building their inclusive education program. And now I'm doing consulting with schools to help them develop that and build that ability. And the last thing I'm doing is a few years ago, I did an ECHO, which is an online virtual support this was for professionals, and it was about autism and building awareness and knowledge and trying to break down any gaps in that and helping so that parents can get the support in their communities. And we are working across several different countries in Africa. And I'm in the works of possibly starting another ECHO. I'd like to reach out to parents throughout Kenya and continue working with professionals in that regard. So I will. I have a new website up and a Facebook page, and both of those will reflect as the ECHO moves forward. Thank you.
Thank you, Trixie, for that. That's really good. And also, Alice, about your psychosocial, I think parents really appreciate that. We need those support groups, especially, coming together and talking about all our problems, or, we really need that. All our kids are different. Pooja, you wanted to add something to this topic, to this particular question?
Yeah, I probably need to start writing things down. I forget a lot. I should also mention, Kaizora has also been providing telehealth during COVID. It's so that's something that is available. Speech therapy, behavior, all those. Yeah, I recently started a lecturer position at Tangaza University College, which is a local university, and the course I'm teaching is special education, special needs education. But within that course, I am doing some framework around ABA, around universal design for learning, around those aspects as well that I've found very beneficial for my therapist, as well as those were my therapists who are doing running the special education section and all that. I've had a lot of staff moving to different places. It's very difficult training them from scratch. So I'm really happy about this program, because it's something that also other organizations who need to hire, who are looking for that expertise, or people who are looking to be trained in those fields can look into enrolling for such courses. So it's something that they can look at Tangaza
thank you.
University.
Thank you for that. Thank you for that addition. And I'm just going back to asking all of you, when parents, where in Kenya can you, when parents want diagnosis, when parents want to look, where can you send parents or direct them for diagnosis or support groups? I know Alice already has one that's in WhatsApp. Where else can you send parents? Or you have a doctor, there's always, people are always asking, where do I start? So where would you start, Alice, if a parent came to you? Unmute.
Sorry for that. One of the key challenges parents have experienced is in terms of diagnosis, and especially the availability of diagnostic tools within the country in terms of diagnosis. But I would say locally, a lot of instances, we will refer parents to the nearest sub-county or sub-district hospital within their setup, within their county, when it comes to diagnosis of their children. When it comes to educational assessments, we refer them to the nearest EALC, or Educational Assessment Resource Center, within the zone that they are in. A lot of times we find diagnosis in Kenya is being undertaken either by the medical professionals, the doctors, by occupational therapists within the hospitals, and by various professionals, the child psychologists within the hospitals, all the neurologists, or even the first person that you see, the pediatrician within the hospital. So sub-county district hospitals, we have Kenyatta National Hospital, we have like now in Nairobi, we have Mama Lucy, we have Bagathi, and we have Madare. So if it's for purposes of health, the sub-county hospitals, yes. But when it comes to educational assessment, we also have KISE, the Kenya Institute of Special Education. We have KISE, and we have the educational assessment centers within the sub-counties. Thank you.
Do they take long for appointments or something? When they
yeah. Yes, I would say a lot of them. I think during this period of COVID, this period has been the most problematic in terms of diagnosis and assessment. But I would say they have specific days. Each sub-county, you would need to visit the hospital, and then you when you request for assessment, they will tell you the specific days when assessment is available within the hospital. It takes a bit of time, and a lot of times parents in this country undertake assessment for purposes of obtaining the National Council of Persons with Disability card, rather than for purposes of identifying the problems that based on the problems the child is experiencing. And so we find there's a lot of delay when it comes to diagnosis. There's a lot of delay, and a lot of children are being diagnosed at a later stage, because I think I would also mention that one of the key challenges we've also had is there are no clinical guidelines for identification and management of persons on the autism spectrum. And so that has been an issue. Yes,
that has been an issue. Thank you so much for the info. Pooja, you want to add on that? I see while we wait for Trixie with internet, but we can go ahead with Pooja.
Yeah, so when a family first comes and they're looking for a diagnosis or they're looking for assessment, we actually start in-house. At our Tanzania branch, we work with a brilliant pediatric neurologist. He's the third director at the Tanzania branch. So that's very convenient for us because we pull him into a lot of our Kenyan affairs as well. He comes, well, when we're COVID-free. We usually bring him down about 3 times a year, so that there is me as a BCPA, pediatric neurologist, speech pathologist. I've also got a master's in education, and in special education. So combined, we're able to work through making a diagnosis if a diagnosis is needed. I am not an advocate for a single person making a diagnosis on their own. I very much push parents to make sure that they seek a multidisciplinary team to be able to do this. Brooke is also a psychologist. So between us, we have a range of professions, a minimum of 5-6 professions that we're able to then, review and put things together through some observations and parent consultations. For support, we also start that in-house. If somebody enrolls, we have a WhatsApp group within Kaizora for all the parents. So they're also able to bring up concerns, talk to each other. If they want trainings for something specific, we're able to do that. We've done trainings in the past on caregiver trainings in terms of behaviors, dental care, speech, functional communication, a whole range of various topics. I know once I did a training for DTSK as well with Alice.
Yes.
It's been a long
Yes, you
time.
did.
I think we need to get back on that
Yeah.
more.
Yes, we do. We do.
But when parents are also looking for other forums, the first place that I do send them is DTSK. I do suggest for them to join on such platforms or even on Facebook, but always to be cautious and to do their research because you'll get a whole range of information from these platforms. And it's important to educate yourself in addition to what you hear out there. So that is what we mostly do. And then if we're not able to do the diagnosis or anything in addition, then it usually depends on an individual need who we're going to refer the person to. There are many people we can refer to. We have a list that we keep for referrals, but it usually depends on an individual need if we feel that we're not the right people to help the family. There's also a range of schools that I work with in the area. So if they have children of concern within the young years, then they'll call me to come and do an observation so we can speak with the parents, really encourage early intervention. Also, the beauty is we work with the same schools when we're transitioning the kids back to school. So once they've come, they've received intensive intervention and they've gained group skills and we now want to move them back into school. Gradually, we have schools that we're able to work with quite nicely. So yeah. I think that's it.
Thank you so much for that. I hope that one day we can all just have. Do you do like have an event for assessment and diagnosis, Pooja? The way you say or the way you and Alice work together on bringing events together.
Sorry, just say that again.
Like when they can, like when you and Alice, what do you do? Do you come together and do events together?
We used to. I mean, with Trix, all of us actually, we used to work together in Autism Awareness Kenya, and we used to have events even on a monthly basis. Those are days I feel I had a lot of energy, and we did so much. But even past that, Alice and I, we have met once or twice. But in terms of still referring to each other, if a parent is looking for support, Alice is a parent of a child on the autism spectrum, so she understands firsthand. I always say that, I can never be in a position that a first time parent receiving a diagnosis when they don't know what autism is will be in, because even if I get a child who has autism, I know what autism is. So I can never be in that position. I can never fully understand. So we have to be able to link them with others who do understand what they're going through. So even a lot of times I have a group of parents who are always willing to share their numbers. So I'll call them and be like, look, I've just met a new family and it's very similar, the struggles that you've had, can I link you up? So there's a lot of links that we do that way as well. But with Alice, it's whenever I think the opportunity arises.
All right. Trixie, you want to add to that? Where do you send parents in case they come to you for diagnosis?
So I do provide diagnosis. So I usually work, I try to collaborate with, if they have a pediatrician that they like, I try to collaborate with that. If they need a pediatrician, I usually work with Dr. Alia Mohammed or refer to her as a developmental pediatrician. There's also Dr. Susan, forget her last name. I'm going to mutilate her last name. I can't remember it. What's her last name? Anyone know?
Wamithi.
Wamithi, yeah, thank you.
Wamithi.
So
Dr. Susan Wamithi, yes, over the Khan, yes.
Yeah, Dr. Khan, 2 developmental pediatricians here, which is great now. But also with other pediatricians, and usually if there's a speech therapist or occupational therapist, different people on board, try to collaborate as a team and get a team assessment. So that I can do, and I can do the diagnostic piece. Often kids come to me already with a diagnosis, or they might just have like developmental delays. I have several little kids right now that it's not clear if it's autism. We start working, we assess, I use different tools to assess where they're at and fill the gaps and work from there. But when I refer, especially if I have a child diagnosed on the spectrum, especially a young child, always try to link the parents, Pooja and Alice have said, with other parents, and I have a variety of parents through the years. Alice was my go-to for many years. I think it's how DTSK got started with us, referring parents to her, and she was just sort of a good group leader and a natural born, just sort of leader of other parents. And it's a great organization that she started and much needed. So I think that's the first stop, is once we have the diagnosis, or once we think, making sure they have other parents, like Pooja was saying, that really understand, and also supporting them, making sure they have family or religious support somewhere that they can be supported. But there are, like all the places Alice mentioned, the ERCs, the hospitals, KISE, local, counselors and psychiatrists, psychologists, neurologists. But I do, and I think I'm a long way, but it's always a little cautious, because a lot of people don't really understand autism. A lot more people do now than maybe 10 years ago. So the face is changing, and doctors are getting more training and understanding. On the echo we were linked with Gertrude's Hospital, had several doctors from Gertrude's that were joining in, and that was the virtual platform where they were learning about autism, and that was great. And they were doing case studies, and that's the great thing about that echo, is people come in with a case study. We do a didactic training about a topic related to autism, and that was wonderful. We had doctors, speech therapists, OTs, special needs teachers. So I think more of that is necessary, and just making sure that doctors and professionals are well equipped in order to see it when it's autism, and not be afraid to diagnose. I think a lot of doctors pass the buck. They send them somewhere else. They send them to this clinic. They send them there, but they don't want to say it's autism, and maybe they're not confident enough in their skills. And so we need to build that. And I find that a really important area to continue building people's knowledge and ability to assess and diagnose correctly, so that we get the kids early, like they get the diagnosis early, and then it's making sure there's enough services available. So yeah, so I think some of the places that were mentioned, and as well just continuing to build the capacity to be able to assess correctly.
Thank you, Trixie. I see Alice is also saying that private hospitals like Gertrude and Aga Khan offer assessment. So I'm going to ask this question. How can we in Kenya, put our heads together the way we are here, have an assessment or diagnosis event where people can bring their children, parents? What can we do? How can we all work together for that particular thing, for diagnosis and assessment? I'm asking all of you, so whoever wants to jump in can jump in.
That's a great question, Ruth. And I think it is much needed. I think it is tricky, because I don't think, when I imagine sort of some of the big medical camps that are held here that are very useful and really great, or aware, like when we used to have the Autism Awareness Days, or the ones that Pooja has continued to do, those are great events, but a diagnosis is such a complex assessment, and maybe red flags and risk factors. Absolutely. I think that could be done. I think actual diagnosis, you need a more, quieter environment. You need a lot of time with the parents to get a history. You need a lot of observation. I think a lot of those situations, the kids are excited, they're hyper, there's a lot going on, there's fun stuff, and they're wonderful. I think maybe if we think of assessment and risk factors, and then having places in place to send them to, and even willing to, to donate their time and money afterwards to do the assessment. But I think that maybe having an event where we could discuss, we could try to get people to come out who have concerns about their child, and then help them be like, yeah, you have the red flags for autism, and here's some screenings, like an MCHAT screening is a tool that is very easy to do. Anybody could really do that. We could train people in, to do that, and then have a list of people that they could go to for follow-up. I don't know what you guys think, Pooja and Alice, on something like that.
So the events that Trixie mentioned, it's the annual events that we've been carrying on, except this year, where we have, actually, we bring in as many people as want to come. It's a free of charge of an event that we fundraise for. And we have different professionals who come and speak about what autism is, the red flags for autism, what kind of intervention should you be looking at. We have forums where parents are able to ask different questions to the panelists. So last year we had the pediatric neurologist there as well, which was actually, it was fantastic because there was so many questions around everything from the red flags to stem cell therapy, you know. I think that is an important case, and because it's free, we try and have as many people come. And then there's follow-up. So we also have professionals who come and can put up their tents there and have a stall so that they can link up. It's also like a network building event where parents looking for information can find information. And, you know, there's kind of a network that's going on over there, and they get some answers. They know where to go from there. We have over 100 volunteers who are coming from universities or students who are then I've had so many who have then been in touch later and saying we've been inspired to go into the field and they're now studying further to help more. And it seems like the community builds that way. So I think events like that are important. More events like that, happening more so is great. And we just need to build the acceptance because diagnosis is not something we can also have an event for. In addition to what Trixie said, we cannot have one event for diagnosis. Diagnosis is something that needs to be available all year long, all the time, because we might have the event today and tomorrow a parent now is concerned about red flags. It's something that needs to always be available. So it's important having awareness, acceptance, and also just being open about where people can go to get help so that they, even when you come across these red flags, where do I go where I can get help in a sensitive and in a way that I'm not going to feel attacked? Or it's very like most of our initial sessions with parents are very much counseling sessions as well. You need to help them work through it. You can't be too technical. We have to, guide them through it. It's a process. It's overwhelming. And being able to do that nicely is important. I don't think an event would cater for that, but having the events that create awareness, that create the acceptance that we're looking for is so important.
That is true. Yes. So I think if we can have like an assessment event with awareness and acceptance, then from there, probably you can direct them to where they can go for diagnosis and so forth and follow up. That is much easier. Alice, do you want to add to that?
Yes, Ruth. As the other professionals have argued, having an event just for diagnosis sometimes may be a bit tricky, given that a lot of times the people coming in are people who already have identified the red flags of autism in their children, or sometimes their children have already been diagnosed. And I've realized a lot of times the key challenge parents have with is not per se diagnosis, but after diagnosis, then what?
Then what?
Because a lot of children are diagnosed by a specific professional or medical professional. So, and they're told their children are on the autism spectrum. But a lot of times they are not told after diagnosis, then what next? And I think that has been a very key challenge. And given that that the government has also invested a lot of resources in healthcare in this country, as parents, we've always wanted and looked forward to seeing some clinical guidelines both for assessing, so that we have a multidisciplinary approach. Because what is happening is diagnosis is happening, yes, but by various professionals across the sector. And a lot of times we find that the parent doesn't get an opportunity to meet various professionals at one sitting, to be able to actually discuss with them on what next after diagnosis. So we would want to see clinical guidelines on not just identification and assessment, but also for management of persons on the autism spectrum. a lot of people are in far-flung areas within this country, and we would say that persons within the urban areas have more access to information on autism, and we find that the biggest majority has not even been diagnosed. They are within the home setup, and parents are expecting that they will achieve some certain milestones over a period of time. So we find that even when you check the statistics within National Council of Persons with Disability, or the statistics, the disability statistics in the last concluded census, it actually tells you that we have a lot of persons within the home setup who have probably not been diagnosed. And even after diagnosis, a lot of parents are not also accessing probably whether it's therapy, whether it's interventions that are available. So we need to see after diagnosis, then what? Yes. Thank you.
Thank you. I'm gonna remove Trixie here and put her back.
Sorry, I've had some internet issues.
I see that. That's fine. So let's all discuss how have talk about the government. Somebody's echoing. Talk about
Sorry.
the government. We're about to wind up. How can we say from then until now have they improved? Let me see whose noise is that.
Can you repeat your question, Ruth?
Okay, sorry. I was trying to. As advocates, okay, so what would you talk? Has the government done enough? Have you seen like they've done enough for in regards to autism support and awareness? What are, just general?
I think Alice has been the most active with the government. I'm going to turn it over.
We'll let Alice answer that.
I think Alice should answer this one.
Yeah, I would say that personally, in the last 10 years, in terms of advocacy and awareness of autism, there's been an explosion within the social scene on matters autism, and people understanding autism more and understanding other developmental disabilities more. But at the same time, I would say over time we've been able to have forums and sittings where government is involved, and the progress has not. I would say when I began advocacy in 2010, the scenario then was very, very different. But I would say as we have progressed over time, even as organizations and DPOs dealing with persons on the autism spectrum, we've found ourselves being recognized and having space even to be able to discuss with government, to be able to discuss with National Council. We are still not there yet. And I know we've raised a lot of issues, even in the social platforms, regarding the issue of clinical guidelines for persons on the autism spectrum. We've raised the issues of stigma, continuous awareness and advocacy, and even in terms of policy. But we still look forward because a lot of documentation has been done, a lot of proposals have gone to government. I know we have been able to have to also have our space in United Disabled Persons of Kenya invited to those forums and meetings, caucus on disability rights, and we've been able also to champion and raise our voice in those forums. And I know most of the documents that have also gone in terms of policy, documents proposing policy change. We have been involved. I would say we have been more involved than we were involved 10 years ago. So much has happened within time. But one of the key challenges we've also had, and I would say the Persons with Disability Act, is still Persons with Disability Act 2003. It's dated 2003. Remember, we had our Constitution of Kenya 2010 passing in the year 2010. So these are de-link in terms of policy and in terms of the law and in terms of recognition of persons on the autism spectrum. Remember, we also have the UN Convention on Rights of Persons with Disability. We have the UN Comprehensive and Coordinated Efforts for Management of Persons on the Autism Spectrum. I think we are not there yet. There are a lot of things that we need to push for. There are a lot of things that we have put forward. So over time, we are hoping to be able to bear the fruits of advocacy. Thank you.
Thank you so much, Alice. So we're going to wind up with the last words, advice to parents. And Pooja, you can say anything you want to add to where we are right now.
Thank you for everything. This has been great. Jackie is not here, so I want to add on her behalf that she has been doing a lot as well. There was a time that her and I put together a document to submit to Kenya Institute of Curriculum Development on various strategies in early intervention, in early identification, in teacher training that can be improved so that intervention is inclusive and starts very early. We also had the head of KICD at one of our BOMAS events where she came and she talked about what they're also trying to do. So I think those have been some good things. In terms of advice for parents, there's so much, especially during COVID and being at home. It's a very difficult time. Some of the few things that I tell all the parents, this works for kids on the spectrum, it works for any parenting strategies actually, is having a routine. Having a routine is extremely important. Having a diverse routine, something that involves indoor activities, outdoor activities if possible. Limiting screen time. I'm not an advocate for cutting it out entirely. We also need, as parents, sometimes that is our break. So it's something that is needed, but making it limited, making sure it's limited, and also the programs that they do watch should be monitored. Try and make things as interactive as possible. So routine is important, starting from morning to evening, breaking down activities, breaking down what happens when. Encouraging communication, whether this is through signs, through pictures, or through speech. Communication can happen in many forms, but making sure that the child has a form of communication is extremely important. If you look at problem behavior and communication, it's like a seesaw. If communication is low, then you'll have problem behavior as being high. So that's something that should really be looked into. If you're not sure how to do it, always reach out to us. I'm always happy to help in any way that I can. Instructions, teaching children how to follow instructions, so getting their attention, giving a simple instruction, trying to give it only once rather than multiple times, and then following through with the instructions so that they're able to learn what you mean by those words. Making that association over time and time is important. Giving them a lot of praise for everything that they do that you want to see increase. Think about reinforcement and praise and your attention, whether you think your attention is negative or positive, your attention as food for behavior. So whatever you give your attention, give it for something positive that you want to see increasing. Behaviors that you want to see decreasing, avoid giving them too much attention, but always follow through. Just redirect the child. So long as they're safe, avoid attention, follow through with what you're doing, but do it in a positive way. Redirect them and give them praise when they do complete the activity well. These few little things actually can create such a big change in the child's behavior at home. And again, I say, if anybody needs help, if you're struggling, if you need some support, do reach out to us. We're always happy to help out wherever we can, however we can.
Thank you so much, Pooja, for that close. Trixie?
Thank you so much, Ruth. This has been a great event, and it's good to connect with Pooja and Alice. Don't see each other very often. And once upon a time, we spent a lot of time together, but it's been a while. So I would just, Pooja gave some really great strategies for parents, and I would say the two things I would add to that is to make sure you're finding ways to connect with your child. And so through play, through interaction, through whatever the child's interested in, making sure you're just finding ways that you're connecting. And a few moments of connection can go a lot further than, half an hour of interaction that's not connected. So really looking to connect with your child and making sure as parents you have some support system, whether it's a friend you call, whether you go to church, whether it's you go for a walk or a run, whatever it is you do to de-stress, to help yourself. This is really unprecedented and difficult times. And so making sure there's some way you can find a support. That would be my two things I would sort of add to that. And just a reminder, I'm with Keep It Peo Therapies. I have a new website. Check it out. It's still in progress of being updated, and a Facebook page that's new too. So happy to be here, and thank you so much.
Thank you so much, Trixie. Alice, would you close?
Thank you so much for hosting me in this forum, and also coming together like we did many years ago in Autism Awareness Kenya. And it has been a journey of advocacy, and we are happy. We are happy to be here. So to parents, I would say you are the first teacher of your child. So always remember that you are the first contact with the child. So you have to keep connecting with the child. You have to look for ways of the child communicating. You have to ensure that even where they probably may not have speech, you have other alternative ways of communicating with your child. Remember that that a lot of this behavior is communication, and you need to look out also for triggers of certain behaviors, either within the environment, or if you keep a close touch with your child, you will be able to understand your child more. At the same time, I encourage parents to ensure that the early intervention, they ensure that they take early intervention for their children. Don't take too much time before you intervene on some certain things happening within the home setup, or within whatever environment that it is. At the same time, I would also ask parents, are you well? Because for you to be able to take care of your child, you have to be well first. So psychosocial support is very key. Reaching out to professionals is very key. Identifying the red flags. Remember, persons on the autism spectrum are not similar in nature, and remember that your child is your child. When you meet one person on the autism spectrum, you've just met one person on the autism spectrum. So remember that there will be unique things that relate specifically to your child. So you need also to discuss also with your network of professionals. You need to reach out, seek out information, attend the online workshops that professionals are providing. Especially, we have a lot of free workshops happening within this period of COVID. Don't just sit and mourn within your space, but ensure that you reach out to others, and you also sacrifice a bit of your time to understand what autism is, what red flags are, and what interventions are there, and what is scientifically proven. Also, don't just listen to what others are saying. Also, do some research, so that you also do not fall into some certain traps of some sort, or you don't undertake interventions that are also risky for your own child. Yes. Thank you so much, Ruth, for hosting us. And I'm
Thank
happy
you
to
so
be here.
much.
Thank you.
This has been a great panel talk, and parents who are watching this, like me, they are here, they are open. You can reach out to Pooja, professional level. She's a professional on Trixie too. She's also in counseling. Alice with psychosocial support and all advice. Please reach out to them. I vouch for them, because they really, it's all about our children. They're there to support our children, and I'm so happy to have this team here. Reach out to them. I think their names I'll put their names again above this video, and you can always talk to them on the side. I know they are willing to help, and so as they say that an autism child brings the consciousness of a village. So thank you guys for coming here and talking with me. I know Jackie couldn't make it, and the other lady too, but I would say it's been a pleasure hosting you guys. Bye-bye. All right.
Thank you.
Okay.
Thank you, Ruth.
Bye.
Bye.